The association has been described for years, although in some diseases more clearly. The classic example certainly has been uterine cancer for many years, endometrial cancer being linked to obesity in certain groups of patients. But breast cancer, there's about a doubling of the risk of breast cancer and a bad outcome in combination in some studies so far. And in some age groups, especially postmenopausal breast cancer, there's an association between obesity and development of the disease, especially the ER positive form. I want to add something here, though, that's very important. Many of us are used to associating tobacco use with specific cancers, and we believe that we can attribute a specific patient's diagnosis to that risk factor, tobacco. This is not yet possible in breast cancer. We can't say, and we shouldn't really be tempted to try to say to any individual patient that we know why she developed the disease that we're seeing her for. Yes, obesity is a risk factor for the disease, but it's one of many, and we don't yet have a way of knowing that an individual's breast cancer was caused by that. Now, when we see patients, they've been diagnosed, and the question here is, what can we do about that? And we can advise weight control, calorie restriction, exercise. It's generally good for our patients. It is probably good for them in terms of breast cancer. But today all we have is association. We don't yet have clear evidence-based interventions yet. We're trying to develop them through prospective clinical trials that are really familiar to our community. They look and design like the kinds of studies we would use in the adjuvant setting to test a new drug, except here the drug is weight control and exercise.